So I'm going to start, since we were talking about reproductive, the labor. It's a classic story with when you start uterine contractions that are usually precipitated by the release of prostacyclins and prostaglandins. So uterine contractions, they increase pressure on the uterine cervix. You know, when uterus pushes the future baby out, are you following me? The head of the baby or whatever part is there starts pushing on the cervix. So that increased pressure increases release of oxytocin from posterior pituitary, and oxytocin stimulates uterine contractions. Does that make sense? And this is classic positive feedback. So, you know, eventually when waves pushed out, that's it, right? Now, another reflex is breastfeeding. So you have two components to breastfeeding. In both cases, the stimulus is suckling. So in one case, check this out, suckling decreases, the stimulus from suckling from the nerve endings in the nipple, hypothalamus. So that results in the reduced levels of prolactin inhibiting factor and increased levels of prolactin release factor. They act on anterior pituitary gland, which releases prolactin. What do you think prolactin does? Stimulates milk production. Does that make sense? And suckling stimulates posterior pituitary gland, which releases oxytocin, which stimulates contraction of lactiferous ducts. Let down reflex. Does that make sense? So this is your so you see now we need two hormones. Just producing milk is not enough. Does it make sense? What's interesting though is that the actions of prolactin are long-lasting. So basically every act of breastfeeding stimulates milk generation. You see what I'm saying? But during the actual breastfeeding, stimulation of a nipple will result in the immediate let-down reflex. So this process will subside after the baby is, taken off the breast. Does that make sense? Few words, it's kind of random, just mentioning. So estrogen and progesterone, remember, that are produced by the corpus luteum if the fertilized egg is generated. So what they need it for? Estrogen is critical for the growth of uterus. It has to incorporate fetus. And it also stimulates the growth of breasts. Does that make sense? Basically, you need more breast tissue to generate more. Well, actually, it's not true. No, not true. Well, kind of true. More breast tissue makes sense to generate more milk. but it's not 100% necessary. Now, progesterone itself is critical for the proper development of stratum functionalis, to keep, Jesus Christ, to keep embryo implanted. And now, you know what's really important? High progesterone levels, listen, they inhibit the motility of the uterus. Are you following me? So uterus doesn't expel the blastocyst and the embryo. And that can actually happen, you know, like it can happen in a female. What can happen? Egg can be fertilized. It can get all the way to the uterus and may not be implanted and will be passed with menses. Or it can get implanted and will be, but not like thoroughly. And it's normal, like there's nothing wrong with it. It can kind of detach and get out. It can happen. Does that make sense? And not every fertilized egg will develop. Okay, good? Now, last reflex, which is kind of weird, but I forgot to mention it. It's Michelin Reflex. It doesn't belong to reproductive. It's your renal system. It's agonizingly simple. Look. So I've got bladder stretch, right? So at the local level, via spinal cord, autonomically, internal urinary or internal urethral sphincter relaxes. Now, when bladder is stretched, okay, when you feel the urge to go to the bathroom, do you immediately pee? No, you don't, because you have an extra one. Okay. Urethral or urinary sphincter. What I want you to appreciate, this sphincter, the internal urinary sphincter, is involuntary. External is voluntary. Okay, does that make sense? Good. When we do potty training on children, we essentially make them, teach them how to control the external urinary sphincter. That's all. Babies they don't have the conscious mechanism of control. Does that make sense to you? Yeah, that's just, this is really what you need to know, that internal urinary sphincter is controlled involuntary, basically autonomic function, and the control goes to the spinal cord, and external urinary sphincter, you're consciously controlling it. Any questions? No? That's it.